All right, everybody. Botulism treatment. Make sure I say that right and enunciate. Another quick little lecture for you guys. Not a ton of stuff going on here as far as drugs are concerned, but anyways, yeah, it's just one of those topics we got to cover because of the NCCPA blueprint. It's on there, so I want to make sure you guys know about it, at least a little bit. So hold on just a sec. All right, super loud helicopter there. I don't know what was going on. Sorry about that. If it disrupted your listening enjoyment. All right, introduction. Botulism is very rare, but it is life-threatening disease caused by this bacteria, Clostridium botulinum. Interesting history there. Just go ahead and read that. Types of botulism. So we have foodborne, infant, wound, adult enteric, inhalation, and iatrogenic botulism. Why does it keep doing that? Sorry, having technical difficulties. Oh man, are you kidding me? Are you kidding me? All right, I'm still recording. Sorry. All right, hopefully this won't happen anymore. And luckily I wasn't cussing. I forgot I was recording. Okay. So where was I? Oh, types of botulism. So just read through those here. Oh man, seriously. All right, so let's hopefully try to not do that again. I don't know what I'm touching or what's going on with my laptop. My computer's acting crazy. Types of botulism. I feel like it say types of botulism, and like it's like possessed or something, like shuts down. Types of botulism. So here we go. Just read through those. Let's see if this works and doesn't. Well, let me change slides. Kidding me. One sec. All right. I don't know what's going on. Maybe my computer's not happy with me or something. I don't know what's going on. Sorry about this. Unprofessional. I know. I'm really apologies. Let's just get into it. Hopefully this doesn't keep acting up. All right. Treatment. Any patient with clinical signs, symptoms, or history of suspicion for botulism should be hospitalized immediately, and they need to be monitored, especially for signs and symptoms of respiratory failure. So again, I think you'll getting this in ICM, I think. So just overview to make sure everyone's on the right page. Monitoring too, just FYI, I'm not going to be testing you guys over this. Maybe help with ICM, but just read through that. Antitoxin. So in the US, there are two. There's a horse-based one, which is the equine antitoxin, and then there's a human-derived toxin. There's also in the US a pentavalent antitoxin, but that is only used for military purposes. The Department of Defense, the DoD, is the only people that can use it. So, I mean, maybe if you end up working with the government agency or, I don't know, working for the military or whatever, you may have a third option there. But for us civilians, we don't have that option. So we have the two here through the CDC and health departments and stuff that you can get. So this one is, like I said, mentioned, you can get through the CDC, health departments. And read through all this. It's good stuff. Also, poison control centers can be good too. So to help find it, but CDC is a great source too. Anyways, just read through this too. Note here too that the antitoxin should be administered as soon as possible and should not be delayed while they're waiting diagnostic studies. So it is, because it is so life-threatening, that there is rationale to just go ahead and administer it. Here you go. Here are the dosages, just FYI. There is a possibility, because it is horse-based, there's equine-based, there's a possibility for anaphylaxis or sensitivity reactions. So that is something to be mindful of. You can do skin testing can be performed if you're concerned about that, or if a person's at high risk for hypersensitivity reaction. Then there's a human-derived, which one advantage to it is you don't have to worry about as much of a concern with the hypersensitivity reactions. And this one is supposed to be used IV in infants less than 1 year of age. So it's also called Big IV or Baby Big or Big IV. But yeah, Baby Big, I thought that was kind of a good name. It reminds me of Big Baby. Shout out to Dram, Big Baby Dram. No, I don't know if anyone likes his music, but I like Big Baby Dram. So that's what that one is for. Antibiotics, not really recommended, but they are widely used. They are popularly administered. So Pen G is one. And if a person is allergic to penicillin, metronidazole as an alternative there. If they have a wound or other things that are going on, you definitely want to try to cover and give antibiotics for the other infections they may have, some kind of, and that can happen. However, aminoglycosides are contraindicated because they can actually make things worse for the patient. So highlight that, look at that there, make sure you read that and understand that. And like I mentioned too, wound botulism, there can be other things that are used because of other infections and stuff on the skin. Antibiotics are not recommended for infant botulism or for adults who have suspected GI botulism. So those are some instances where you should not use antibiotics. Oh, super unprofessional. Sorry about that. Pro tip, always silence your phone when you start a recording. So sorry about that. That was my wife. She's got a break for lunch, so I'm going to have lunch with her. But sorry about that. I had that stupid ringer too. Dee, 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 dee. All right, sorry. So what was I saying? Other treatments. So with foodborne botulism, there are some other GI things you can do. Give laxative enemas. That can help. With a wound, like I mentioned, you need to treat the wound, do debridement, other things like that. And then tetanus boosters are important. This is a medication that's kind of experimental right now. You may see it in the future. It's it's a drug that increases acetylcholine. Controversial right now, and it's kind of, so maybe stay tuned. Maybe in the future, don't worry about it for testing purposes for my exam. And then bioterrorism. Unfortunately, this is something that can be used in bioterrorism. And that's part of the reason the DoD has its strategic, supplies, and CDC has its strategic stockpiles and everything. But it's a similar management. So it doesn't matter, so this management that we went over here works for the bioterrorism as well. So that's it. Sorry for the crappy recording today. My computer was possessed and acting crazy, and then my wife called, and that was unprofessional, and I'm sorry. But anyways, not too bad. Not really that much in here, but like I said, a topic I was told I needed to cover. So there we go. Email me if you have any questions, comments, feedback. Make sure you hit that like button and subscribe if you're new here. And I'm joking. I watch a lot of YouTube videos. So a lot of times I want to say, please, if you're new here, subscribe, hit that like button. But anyways, you guys we're not on YouTube. Thank you guys for your time and attention. Sorry again for the unprofessional recording. I'll talk to you guys later.